Hi, I'm Dr. Bernard Teo, GP and Clinical Director at One Health in Christchurch. On this page, I'd like to share what to expect if you're considering prescription anti-wrinkle injections. These treatments use small doses of botulinum toxin type A to relax specific facial muscles that cause expression lines such as frown lines, forehead lines, and crow's feet. The goal is a natural-looking softening of lines, not a completely different face. Most people start to notice softening of lines within the first 1 or 2 weeks after treatment. For many, the effect on facial lines lasts around 3 to 4 months, and in some cases a little longer, depending on things like the area treated, the dose used, and your individual biology. Results vary from person to person. If you're happy with the result and want to maintain it over time, many people choose to repeat the treatment roughly every 3 to 4 months once the effect has mostly worn off. How often or whether you repeat the treatment is always your choice and something we review together at follow-up. At your treatment, we'll talk through your concerns and goals, take a medical history, and examine your facial muscles in movement and at rest. We'll then discuss whether anti-wrinkle injections are suitable for you or whether another treatment or no treatment may be a better choice based on your health, anatomy, and expectations. People often ask about units and how they compare. Each prescription brand has its own way of measuring units, and those units are not interchangeable. 20 units of one brand is not the same as 20 units of another. Your dose is individually prescribed for you, so focusing on unit numbers or price per unit can be misleading. During the procedure, we use a very fine needle to place small amounts of medicine into carefully selected muscles. Most people describe a brief stinging or scratching sensation at each injection point, with discomfort that is usually mild and short-lived, although everyone's pain tolerance is different. If you're particularly sensitive, we can discuss simple options such as ice or numbing cream to help you stay comfortable. As with all medications, there are potential side effects and risks. These can include temporary redness or bruising, headache or discomfort, and sometimes unevenness or drooping in nearby muscles. More serious complications are less common but can occur. We'll go through these in detail, provide written information, and give you time to decide without any pressure. This video is general information only and not personal medical advice. If you'd like to find out whether prescription anti-wrinkle treatment is appropriate for you, you're welcome to book a consultation at One Health so we can discuss your goals and options properly, face to face.